My name is Corinne Schuster-Wallace. I am the co-chair of the Canadian Coalition Global Health Research Working Group on Climate Change. And so we have convened this session to explore climate change within the overarching theme of the conference. I am also a water health researcher for the Global Water Futures Program, which is a large Canadian consortium research program that's ongoing to basically improve modeling and forecasting and data and tools to predict and to respond to the water challenges that we're experiencing now and will continue in the future, particularly in cold climate regimes, so where there's snow and ice. I'm a member of the Global Institute for Water Security and the Centre for Hydrology, and I'm also in the Geography and Planning Department at the University of Saskatchewan. And that's about all you'll hear about me, and I'll be your chair for this session. I'd like to set the scene for the rest of the speakers, just so that we're all on the same page and that they don't have to keep going on and on about the linkages between climate change and health. I'm sure many of you are aware of them, but I just wanted to, as I say, get us on the same page. And when we're looking at climate change, it impacts the weather. That's really the most direct. We are seeing floods and droughts, heat and cold waves, UV challenges. It also affects plants, water, animals and insects. And in turn, this means that we're impacting infrastructure, nutrition and hydration, vector-borne, waterborne diseases, wash, navigation, transportation, just to name a few. But what this leads to and why we're all here is that we're looking at infectious diseases, exacerbation of chronic diseases, displacement, we heard a lot this morning, the lack of and the inability to access professional healthcare and education, unpredictable and increasing burdens on healthcare facilities and systems. And so climate change is having cascading effects in conjunction with other global environmental change drivers, population, migration, and also urbanization and land use, land cover change. And what this means for us is avoidable mortality and morbidity, obviously, and particularly women, children, and vulnerable groups. But it's also leading to failure to achieve potential and suppression of national economic growth, which is where the ministers of finance start to pay attention, and political instability. And I'll give you one example from Canada, where Manitoba had a series of 1 in 100-year flood events that cost over $1 billion each within a couple of years of each other. It led to the government raising the provincial sales tax, which actually ended up in a complete political turnover. So even in high-income countries, these political instabilities can occur as a result of what we're seeing in climate change. This is from a recent publication that I've co-authored with several people in the room here, but just wanted to give you a sense of, again, these impacts to pathway of climate change, because they aren't just direct on health. And so this is an example of climate change nutrition and the intersection with maternal and newborn health. And so, again, climate change, changes in precipitation and temperature, this could lead to improved crop productivity and conditions for diverse crops to be grown, which actually improves maternal and child health nutrition. But when you look at the demands of prenatal vitamin and mineral requirements and the high nutritional demands of pregnancy and lactation and the first 1,000 days of child's life, then we start looking at the health consequences from birth defects, stunting, cognitive impairment, infection risk, and basically mortality, morbidity, but again, leading to decreased economic productivity and increased healthcare costs, which affect a country's bottom line. So it's against this backdrop that we convene this session, and we convene it to explore questions of what engagement mechanisms have worked to bring diverse stakeholders to the table around climate change and health. As you've seen from the couple of slides that I've shown, we can't just have public health officials in the room. It can't just be medical. We need climate people, we need modelers, we need all kinds of people to be looking at this and contributing from their different perspectives. How can intersectoral groups affect governance and policy around climate change? and what are some of the effective governance structures that are able to build resilience and mitigate the health impacts of climate change. And this is set against a backdrop of the declaration of climate change being a public health emergency by the Canadian Professional Associations earlier this year, and also it being a global health emergency. So without further ado, I'm going to introduce the panelists, and then they'll come up one at a time, and at the end we'll come up and sit as a panel. I realize that if they sit up here they can't see the presentations, so they'll join us at the end. And we're going to have sort of 45 minutes to an hour of their presentations, and then the rest of the time will be open for discussion. So questions, if you have any examples or case studies yourself, I'd ask you to be very brief, keep them to 1 to 2 minutes so that we can have as many people sharing as possible, and really want to foster that open dialogue and sharing of case studies here. So I'll introduce Rosmond Adams. He'll be our first speaker. He's the Head of Health Information, Communicable Diseases and Emergency Response at the Caribbean Public Health Agency, or CARPHA. So he isn't busy at all at the moment with the hurricane season. He leads on the Regional Coordination Mechanism on Health Security, a multi-sectoral mechanism that addresses issues such as pandemics and climate change. He's a member of CCGHR, and he's one of my colleagues in the Working Group on Climate Change.
Hi, good morning, everyone. Thank you very much, Corinne, for the introduction. It's really good to see so many people in this room. It speaks of the interest around climate change, and not only being interested in climate change, but to show that people are aware of the impact of climate change on human health. I'm also glad to see so many young professionals here. It is very hopeful and shows that there is room, and that there are persons who in the future and presently will take up the advocacy role in really continuing the fight that we're doing with respect to climate change. As all of us know, climate change is real, no matter what others may say, and it will impact all of us one way or the other. And we know that action is required with respect to climate change. If we take no action now, then we will be running wild somewhere down the road in really putting some actions. So as Corinne would have mentioned, climate change, one of the important impact that climate change has is on the weather, on water patterns and on the weather, and it has been declared as one of the 10 public health threats by the WHO. That climate and its related impact on health is very important. So as a public health person, I work in public health, and I'm also an ethicist. So I think that climate change has a significant impact on public health, but from the ethical point of view, I think that all of us do have a role and an obligation to protect the environment and to really work for action towards climate change. So my presentation is entitled Climate Change in the Caribbean: Governance, Engagement and Action. So I'll start by telling a story. It's not the most interesting story that you may want to hear. However, it is worth telling. In early September, which is this year, a few months ago, Hurricane Dorian, a Category 5 slow-moving storm, impacted the Bahamas, leaving behind a trail of damages with more than 61 deaths and over 400 people still missing, with an estimated damage of about $7 billion. And this storm was unprecedented in that it stood over a very small island for more than 24 hours. The second is in 2017, Hurricane Irma, which is a Category 5 hurricane, impacted multiple Caribbean countries. The island of Barbuda was entirely wiped out, and significant damages were reported in the British Virgin Islands, St. Martin, Turks and Caicos Island, and many other Caribbean countries. Again, unprecedented, multiple islands being affected during the hurricane season. Generally, we will have only one island during the Atlantic hurricane season, or during the trajectory of a hurricane being impacted, but we're seeing multiple islands being affected at the same time. 2 weeks later, after Hurricane Irma in 2017, Hurricane Maria, a deadly Category 5 hurricane, devastated Dominica, the U.S. Virgin Islands, and Puerto Rico. So we're seeing, you know, more Category 5 hurricanes coming through the region. With respect to data from the Caribbean, studies have shown that mean surface temperature in the Caribbean have increased by approximately 1 degree Celsius over pre-industrial times, and warming is occurring at approximately 0.2 degrees Celsius per decade. There is a 1.5 degrees increase of warming that may occur by 2030. Sea levels are also rising in the region at approximately 3 millimeters per year, and the rate of sea level rise is increasing. The Caribbean Sea and the Atlantic Ocean are becoming more acidic, and approximately 70 to 90% of coral reefs will die at 1.5 degrees Celsius of warming. 99% of the coral reefs will die at 2 degrees of warming. According to the Caribbean Center for Climate Change, which is called 5Cs, a 1 degree increase in sea surface temperature will cause about 1 to 8% increase in hurricane wind speeds and a 6 to 18% increase in core rainfall from hurricanes. So what does all of this mean to us in the region? It means that there is increase in the incidence and the intensity of extreme weather events with direct negative impact on human health. And so these events are events such as heat waves, wildfires, droughts, hurricane floods, etc. The Caribbean region is a region that is very vulnerable to these changes. Many countries in the Caribbean are what we call SIDS, small island developing states, with very fragile economies, and they depend on a single crop or a single service such as tourism or banking, and these can be wiped out in a single event. So as we've said, like in Barbuda, when Hurricane Irma impacted the island, the entire island was wiped out and everyone had to be evacuated. So it really shows the vulnerability of these small island developing states. The region have suffered from very slow economic growth, and the road to recovery from these disasters is often very slow and very long. Even as we're in 2019, we will hear reference being made to Hurricane Thomas that took place in 2010, and countries are still recovering from the impact of Hurricane Thomas that affected the Caribbean in 2010. This is 9 years after. So the road to recovery after these disasters is very slow. So we should touch on governance very shortly, and to really show that the Caribbean region has understood the importance of climate change, and we're really moving towards taking action to respond to climate change. So the region's position was first articulated in 2009 when there was a Lindell Declaration on Climate Change and Development, and this was the heads of government of the Caribbean region under what we call CARICOM. CARICOM is a political body in the Caribbean, and they've come together in order to address the issue of climate change on the region. And the guiding framework for climate change action in the Caribbean, which was a regional framework for achieving development resilience for climate change, and it was over the period 2009 to 2015, was produced by the Caribbean Community Climate Change Center that is called 5Cs, with its implementation plan for regional framework produced in 2011. The work of 5Cs is also supported by CDEMA, which is the Caribbean Disaster Emergency Management Agency, through the implementation of its mainstreaming climate change into disaster management for the Caribbean region CCDM project, which is aimed at incorporating climate risk consideration into national disaster reduction management planning, and seeks to strengthen the overall response to the hazardous effect of climate change. So this is really showing that in looking at how we tackle climate change, we're not doing it in silos, but we're even when we look at disaster management, the whole issue of climate change is being built into this. And so within the regional cooperation agenda, disaster risk reduction is not seen as an issue separate from climate change, but rather as a mechanism for coping with its effect. The challenge has been to rally the region to embrace the philosophy of disaster risk reduction, that is, pursuing ex-ante activities before the event in order to reduce its effects as opposed to acting after these events. So we've understood that climate change has a real and it has an impact on us, and therefore we have to move to respond before other than waiting until after these disasters to respond. In terms of engagement, we've recognized that as a region, we cannot act alone. So the phenomenon of climate change is really not something that we can solve by ourselves, and so we need multiple partners in doing so. And so we're engaging in the region partners at the national, regional, and international levels. At the national level, we understand and we know that community participation is very important to foster an all-of-society approach, because even though at the community level, persons may think that they are not empowered to act or to solve this issue of climate change, it is on each one of us individually to start taking some level of action, and it is at the community level that change will start in terms of putting the pressure on leaders and really having a voice. And so we recognize that at the level of the community, action must start there. At the regional level, there are many institutions in the Caribbean that have been working, whether it is to generate evidence or to work in terms of advocacy or to work in disaster risk reduction. We've been engaged in these organizations. So we have the Caribbean Public Health Agency, from which I come, and we work on climate change and health-related issues. And we are also supporting climate change and the impact on the health sector, because we recognize there have been a lot of work or a lot of research on climate change and its impacts on human health, but the one gap still exists is on climate change and the impact on health systems. And health systems is at the forefront of this whole climate change agenda, and therefore, if health systems are not strengthened, and if health systems are not able to respond to the impact of climate change on human health, then of course we have to be we really cannot address the impact on human health if health systems are not in a way to do that. And then at the international level, there's a wide array of stakeholders, stakeholders from many countries, many organizations, and so forth. And there are knowledge gaps that still exist around climate change risk. Especially when we look at vulnerable groups, when we look at the impact on communities and so forth, such as tourism, fisheries, and these gaps must be filled. So the engagement of international stakeholders are very important in helping us to address these gaps. And finally, with respect to action, and I'll speak briefly on two items that I think are very important, is that in 2018, last year, the World Health Organization held the third global conference on health and climate change in the Caribbean in Grenada. And coming out of this was an action plan for the region, which was aimed to protect the health of Caribbean, small island developing states population from the adverse effects of climate variability by developing climate resilience health systems, by increasing awareness and mainstreaming funding opportunities to support countries, and by promoting intersectoral mitigation action in the health sector. This plan will be implemented from 2019 to 2023, and it is on 4 pillars that this plan is built: empowerment, evidence, implementation, and resources. And so the action plan proposes actions to be taken at the national level, at the regional level, and even at the global levels. And there are indicators to monitor implementation in each of the Caribbean countries. And finally, as an example of really the action that we've been taking in the Caribbean, there is a move towards making health facilities in the Caribbean smart. And when we say smart, it's really a platform for integrating disaster risk reduction, climate change adaptation, environmental management, and conservation efforts. And so these healthcare facilities are built on three important pillars in that they're resilient to the impact of these natural disasters. They're green in that there is some level of environmental management and conservation efforts, and they're sustainable in that when there are the impact of these natural disasters, there's a reduction of downtime, they're able to be functional for a long time. So this is really in brief what we're doing in the Caribbean. There are much more that is going on in other sectors, but from the health point of view, this is what I wish to present to you. So thank you very much.
Thank you, Rosamond. Our next speaker is Ngozi Joe-Ikechebelu, and she's a sub-Saharan African woman, wife, and mother from Nigeria. She's in the Social Dimensions of Health graduate program at the University of Victoria, and currently working on intersecting socio-structural issues that affect sub-Saharan women living with HIV in British Columbia. And she's also looking at equity-centered local solutions to climate change in both British Columbia and the Global South. So I'd like to welcome Ngozi.
Yeah, good morning everyone. I want to appreciate CSIH for making it possible for me to be here, and also CCGHR that is giving me a platform to be here. I want to appreciate every one of you for being part of this. I'll be talking about climate change advocacy for human health, using Nigeria as a case study. This is going to be my outline, talking to you about the demographics for Nigeria, which is very important. And when we look at, well, we understand the demographics of Nigeria, it will help us with climate crisis and the challenges that Nigeria is facing as a country. We'll also look at the national policy and the governance structures, and then we'll go down to a state. We're going to talk mainly about one state in the southeastern part of Nigeria, which is Anambra State, and that is where I come from. And we also make a reference to an international organization that is working in Cross River State. And we are going to talk about some narratives, some works we've been trying to do, trying to move research and see how it can move us into action. Then the key messages. According to World Health Organization in their report in 2015, the population of Nigeria is 177 million. But the Nigerian Population Review that came out in 2019 talks about the population of Nigeria being 200 million. And I want to say that this is very important because the World Bank is talking about that the population of Nigeria is going to contribute to 10% of the 2.2 billion increase in global population by the year 2050. Nigeria is the most populated country in Africa and the 7th at the world level by 2015. So this is very important that we know about this demography. This is the growth rate, everything is written here. The life expectancy, look at the life expectancy for Nigeria is 52 years, and the under 5 mortality rate is still high. What does these demographic challenges point towards? It talks about two things, two very important things that we have to look at, and that is the youth bulge, with those under 14 years accounting for more than 40% of the population. And the second important thing that I want us to take home today about Nigeria is the rapid urbanization of the Nigerian society. The Nigerian society is rapidly urbanizing, and by World Bank statistics estimates that urban dwellers representing 50.2% of total population will surpass their rural counterparts by 2018. I want to say something again, that Nigeria is a multi-ethnic society. We have over 500 different ethnicities. And again, remember that Nigeria is one of the largest oil exporter and one of the largest natural gas reserves. It has the one of the largest natural gas reserves globally. But most importantly, it accounts for about 1/6 of the worldwide gas flaring, and flares more than 75% of our gas. Very important. This is very important for us to know. Nigeria is heavily dependent on crude oil resources. It depends on rain-fed agriculture for that population, and impacting on livelihood of its people. And this has an increase in the carbon that is in the atmosphere because of the high amount of greenhouse gases that are produced in the environment. Another thing is the deforestation. When we are talking about the state, you can see that deforestation in the southern part of Nigeria, deforestation is a huge, enormous challenge in the southern part of Nigeria, deforestation. And this is from illegal loggers and from domestic users. And another thing that is affecting Nigeria is that her socioeconomic, political, and these environmental challenges that stem forth they all intersect to worsen the climate crisis. They all come together, making Nigeria, as given by World Bank, one of the poorest nations now. And I want to say that in Nigeria we have low individual and institutional capacity that is affecting the state of art technology that is needed for the climate crisis management, and also the funding. The funding is apparently not there. What is Nigerians' response to climate change? Starting from 1992, being part of a United Nations Framework on Convention for Climate Change, and by 2004 we ratified, and the vision was launched for 2020, and that was when by 2011 the creation of the policy document, National Adaptation Strategy Plan of Action for Climate Change in Nigeria, it was created by then. The Federal Executive Council approved it by 2011, and in 2015 they pledged to reduce global greenhouse gas emission by 20% in the year 2030. That is important because we are going to see some discrepancies. By 2017, it ratified from the intended nationally determined contributors to greenhouse gases. It became its official policy, and this is what has been used. I want to say that the NDC, the nationally determined contributors, has the following sectors that are impacted. There are about 13 of them, and it's all out there. Because of time, I wouldn't go to that. But however, when you look at the plan of action of Nigeria, you see that certain tremendous inconsistencies and discrepancies exist there in that energy policy. When you're talking about also on eco-friendly national medium-term plans, by 2015, the president brought out a medium-term plan for 2017 to 2020, and this was talking about increasing oil and gas production for economic recovery and growth plan. Increasing oil and gas production. How about the impact of gas flaring? Think about that. The second one in that the medium-term national plan talks about coal. We all know what coal does to freshwater reserve, because it was talking about using coal for production at least 30% of the electricity. And another one was the President's Anchors Borrowers Initiative. This was talking about increasing to the farmers, trying to give the farmers pesticides, fertilizers, and we know the impact on greenhouse gases. I want to talk about the Sdg Index Report. When you're talking about the Sdg Index Report, you know that the Sustainable Development Goal, talking about economic recovery, social inclusion, environmental management for all nations that ratify to it, to be part of, every nation should be part of that. But there is this African Index SDG report. This one is narrowed down to African countries. And for that index report, it talked about 97 indicators. These 97 indicators were borrowed from the SDG. So they use these indicators, and it's for African countries that are part of this to look at the 97 indicators and know exactly where they are affected. When you look at that report, and it's based on a range of 0 for worst and 100 for best. And that report that came out, the SDG African report, placed Nigeria at 48.4. Remember the population of the country. It placed Nigeria at 48.4, unlike Morocco, that is 66.1. When you also look at our specific strategic national responses, it talked about 4 areas. These 4 areas in terms of governance and policy, health adaptation, implementation, financing, and also health benefits from when you're looking at climate change mitigation. But there is also a high level of inconsistency in that specific national response. I want to talk a little about it, because if you look at the last three was affected. Under governance and policy, Nigeria has identified national focal points for climate change in the Ministry of Health. It has a national adaptation strategy approved by relevant government body, and this was submitted to UNFCCC with health implication of the climate change policy. This was by World Health 2015. But when you come to the last 3, Nigeria has not implemented any action to build institutional and technical capacities to work on climate change on their health challenges. It has not implemented activities to increase climate resilience of health infrastructure, though one may say that is implementing projects and programs on health adaptation to climate change, is conducting national assessment of climate change impacts, vulnerability and adaptation to health challenges. However, how about disease surveillance? How about disease response? It is not yet proactive in this area. For the financing and costing, there are no estimate costing. You can't have it. If you go to the website, you can't even see anything there. It is absolutely not. It's quite inconsistent with that. If you look at the policy, there's one place about policy that talked about technical capacity and indirectly health. Let's look at the governance structures of climate change. We have the Federal Ministry of Health, of Environment. Under the Federal Ministry of Environment, it has 4 units. You have a unit that is the Department of Climate Change. You have one that is under health education. The other one is is for mitigation and adaptation. But when you look at the intersectoral groups, both at the national, at the state, and at the local level, yes, they are all there at the national level. They are meant to be copying what is happening at the national level, but at the state and at the local government level, it's absolutely non-functional. There is no significant translation of these policies, and this policy that we talked about, the policy, the national policy for Nigeria on climate change, there is no significant translation at the state and local governments. The resilience structures, think about the CSOs, the local CSOs for climate change is next to, it's just a few of them that are working, still talking to the government with advocacy and trying to make the government to commit to what they said they would do on this policy. Now we get into the states. For the states, we're talking about Anambra State, and for Anambra State, we have a population of 4 million. I want to say that Anambra State is in the southeastern part of Nigeria, and one basic thing that is important there is that the river where Nigeria got its name, River Niger, is one of the boundaries. For over 4 years continuously, it's like an expectation now. The flooding will come. One of the challenges we are having from climate change and environmental degradation is flooding, deforestation, and soil erosion. The soil is very loose, so that is affecting the people. Now, presently, the flooding has started, and we know the impact, internal migration. More ironically, maybe because of the closeness of the rural areas to the river, and also from other challenges from waste management in the states. The people that are affected are mainly the vulnerable people, and they are moving. They have internally displaced camps all over. in Anambra State in certain specific areas. And we know the vulnerable people that are affected. Think about women, think about children, think about persons living with HIV/AIDS, and also the disabled people. They are all there. What is the government doing? What happens is that for private initiatives, they can go there and give them some foodstuff, and that is the end. The government has put them in at these camps, and that is the end of it. Now, I want to talk about the stories, what we've done, what is being done in Anambra State. In Anambra State, there is this research group, Nigeria Coalition on Eco-Social Health Research. Is an engagement mechanism that is being used to influence university policy. It was initiated, that is the picture, it was initiated by the Vice Chancellor of a state university. But one thing about this research group is that is an inter-university. There are 2 universities in Anambra State, 2 main universities, tertiary institutions, one of the state university, another for the federal, and you have researchers across different disciplines, public health, environmental management. They all come together and they are influencing policies, still looking at researches with community researchers, so that they can influence research and bring about impact practices and policy stasis in the states. I also want to talk about the Friday for Future. You know, the Helder brought up the issue about secondary schools going on climate strikes. This was done in Nigeria, and also it was this group together with a Nigeria Working Group for CCGHR that implemented it. We were the first to carry it out in Nigeria, and it took place in 2 states in Nigeria. What are we trying to say? If you look at the policy of Nigeria, it talks about that they need the technical capacity. They don't have it for individual and institutional capacity building. Binded by the policy, what is the potential for a possible partnership with a global north organization? This is where I want to end. Another thing I want to say at this point is that I want to bring up the importance of media. Nigeria is still a country that believes that climate change and the weather variability we are seeing is all about maybe a cause from the God. That information, that health promotion, that educational awareness needs to start also with the media, because when the government and the media can talk freely about this, then individuals at their levels in the family, in the community, in the society can also bring it up and start talking about changes, what can come in. International support, I've talked about it. Most importantly, we want to talk about sustainability approach, because one thing is that even if there is an international funding and international support, it will still end. But when you use community academic partnership, sustainability will not be affected. Thank you very much.
Thank you, Ngozi. Our last panelist of this session is Nicole Spence. No, it's Vic Neufeld, but he's co-presenting with Nicole Spence. She was unable to be with us here today. She has a very good excuse. She's the Coordinator of Health Emergency Management in British Columbia, and she has a graduate diploma in Public Health and Social Policy, but she's currently enrolled in a Master of Science in Disaster Healthcare in the University of South Wales, which I don't know how many disaster healthcare programs there are, and I'm Welsh, so I'm very proud that there's one in the University of Wales, but there you go, maybe check it out. And Vic Neufeld probably doesn't need too much of an introduction. He has been a formative member of the Canadian Coalition for Global Health Research. He's an Associate Fellow in the Centre for Global Studies at the University of Victoria, and he was the co-lead in the second BC Coalition Institute that took place in August, and he'll be talking a little bit about that. And he's associated with groups conducting research on climate change in both Tanzania and Zambia. So Vic, on behalf of you and Nicole, thank you very much.
So you've just heard how unqualified I am to do this presentation. My name is not Nicole. I've only lived in BC for 3 years. I'm going to tell a BC story and so on. I guess I could go on. Who's here from BC? All right, so we got some experts in the room. Excellent. Dare I ask who's here from Alberta? A few. We won't get into that BC Alberta story. Could I also ask who's involved in some way in climate action, climate change action? You're a part of a local group working on this, or a university group, or something like that. Can I see? Good. Right number of hands. There's a few chairs around here in the front if people would like to find their way down. So I'll present a story from BC related to the wildfires that occurred in BC in 2017, 2018. Some of you will remember that this was the topic of a coalition webinar in March. Anybody remember seeing that? A few people. Okay, excellent. So what I'll do is present a bit of the evidence of the damage of the wildfires. I'll pause a bit on the degree to which that affected indigenous communities in BC, and then I'll come to the 3 questions that were posed for this session and make some comments about that as well. A wee bit of background. I think you know that BC has been sort of a champion of carbon tax in Canada. People in other parts of the country have said this is just another way of the money, government grabbing money. It's going to affect economics and so on. In fact, it's done just the opposite. It's improved economics in BC, and it stands out as an example that carbon tax, despite its limitations, is still quite a good strategy and is working in BC. You probably know also that 2 years ago there was a provincial election. The Liberal government in power was eased out by just a whisker. In came the NDPs, and together with 3 provincial Green Party members formed the government, and that's been going reasonably successfully for 2 years or so. About a year ago, there was a policy that was agreed upon called Clean BC, and that's sort of a framework now for the work that's going on in the country. For about 10 years, I think, there's been a Climate Action Secretariat, an interministerial group, and I'll come back to that in a moment, because I think it's been a key piece of the engagement, of the policy change, and of the governance structure in BC. So that's background. As I said, these were the wildfires that occurred these 2 years in particular. I think you've all seen stories about that over the time. Here's some of the data about the impact of these wildfires. I won't go through these line by line, but I'll just leave them up there for just a bit so you can see them. Overall, the story was a bit worse, as you see, in 2017 than 2018. Fortunately, this past summer, for a variety of reasons, there were very few wildfires in BC. Some in the Okanagan area and a few up in the northeast corner, but a very different story than was happening in these 2 years. This is just a snapshot of the impacts on First Nations communities in BC. Again, I'll just leave that up for just a bit so you can have a look at it. can come back to this in the discussion if you so wish. So what's been happening as a result? So after these 2 years, these 2 summers in particular, there were detailed action reviews about what was done at the provincial levels and at some of the regional levels and local levels as well, and also by various agencies in government with a set of recommendations and tracking systems in the event of another season like that. My understanding was that this is very intensive work all through 2019, looking at the data and experience of 2017 and 2018. So let me come to the 3 questions that are a framework for this sessions. What have the engagement mechanisms been? Well, as I mentioned, the Climate Action Secretariat has been in place for a good long while, more than 10 years, and it's now got a reputation for conducting educational sessions of one kind or another to facilitate learning and collaboration. The word here is cross-pollination. There are some special case studies or examples of where the Climate Action Secretariat has worked in detail. An example is the General Hospital in Nanaimo. It's actually quite an amazing story of how the leadership of that hospital said, what are we as an institution ourselves contributing to climate change? What can we do to reduce that impact? And what are we doing in terms of our services to our surrounding communities about this? And there's a very good story just about that. So these are examples of how engagement has gone on. Has this affected governance and policy? Well, because the Climate Action Secretariat is a creation of the BC government from some years ago. Sorry, not speaking loud enough. Thank you. Are you getting what I'm saying? Okay. Yes. It has been in place. It has really quite good credibility. People pay attention to it. So these reviews of the activities of 2017 and 18 are in the hands of the Climate Action Secretariat through these various engagement activities. And now, as I understand it, that Secretariat, which is located in a Ministry of the Environment, is reaching out in particular to the Ministry of Health and other provincial ministries as well. So it's affecting policy and to some extent governance pretty directly. What's happening going forward? Well, there are regulations now that are integrated into the it's called the Carbon Neutral Government Program on Public Sector Reporting, and there's a strategy in place getting all set for what might happen in 2020 based on the experience of 2017, 2018, the various engagement activities that were going on in 2019, and let's just see what happens about that. Let me just pause here to say, as Corinne mentioned, that this past August we had a coalition event at the University of Victoria called the Coalition Institute, the second BC Coalition Institute. We used the overall theme of planetary health, local and global, as our framework for that event. We had about 40 people involved, I think, including people from regional government, local NGOs. We had a guest speaker by the name of Elizabeth May. Recognize that? Elizabeth is my MP, so twisted her arm a bit to come and speak to us. In the annual report that some of you may have seen of the coalition this year, there's about a page-and-a-half report on the BCCI. So I suggest you have a look at it. And it was quite an eye-opener for me to see how much activity there actually is going on with the variety of NGOs, municipal governments, and so on. The Victoria area is managed by something called the Capital Region, Capital District Region, and consisting of 13 municipalities within that region. And most of them actually have their own municipal climate action strategy and coordinated by this CRD for the region. We had our participants meet some of these people. Perhaps just one other comment. We also had links with a unique entity in BC called the First Nations Health Authority, and did our best to try and understand what First Nations communities up and down the province were doing themselves with Indigenous wisdom regarding climate change. So I'll just leave it there, and we can probably get into some of this in the discussion a bit later. So let's thank Nicole and her friends for this. So thanks very much.
Thanks, Vic and Nicole in absentia. If the other two panelists, if you'd like to come and join Vic, and I'll open it up for discussions.
Adapt to necessary changes to prevent future damages. Thank you very much.
Thank you. Thank you for that, Christian, and thank you for Victoria. For youth engagement in Nigeria, I want to say that with the onset when the policy document was adopted as far back as 2012, there's been some engagement with youth at the national level. I also want to say that this year, Health from Mother Earth Foundation, in collaboration with Federal Ministry of Environment, organized a youth forum for the youth across the 6 geographical regions in Nigeria. And the organization that I talked about that is influencing university policy, National Coalition on Ecosystem Health Research, was also among the participants for Anambra State. 10 persons representing civil states organizations and individuals were there. There are 5 states in the southeastern part of Nigeria, and they recruited 10 persons or groups from this state. So they went there, that was in July, and there was this training. Presently, there is this, for the people that came from Anambra State, they formed a kind of forum, despite their organizations and the group they come from. They are talking about implementing strategies for effective waste management in Anambra State. Currently, they are undergoing health promotion in secondary school. I want to talk about the Future for Friday partnership that is ongoing presently in Anambra State. What is happening now is that there is a partnership between a high school in Victoria and a public and private high school in Nigeria. Using the Facebook as a medium, they are interacting, and it's not just about maybe the people from the global north giving the information. No, they are exchanging ideas about what works or what is happening in the global south, while their partners, secondary school, high school, Claymont High School to be precise. Then for the people in Nigeria and Anambra State, you have a private school and a public school. So 2 of them partnering with a high school in Nigeria. So that is, it came out from the event of the Friday for Future that happened, that was in May. Thank you.
So with respect to the Caribbean, I would say that many of the Caribbean countries do have national climate change adaptation policies, and in these policies, education is a very important pillar. We recognize that there is a need to have the youth being engaged in climate change resilience activities. However, in these policies, we've also considered that there is the need to have gender-related climate change issue addressed there, because even if we look at just youth or community, there are gender-specific climate change activities that must happen. So built into these policies, we have that happening. The schools are trying to put into their curriculum educational activities, so that even at the when you start at the primary level, there is some level of awareness with respect to climate change and environmental conservation. And even so, as you move forward into probably secondary school or even at the tertiary levels, there is the access to information related to climate change. As part of the climate change adaptation policies that the countries in the region have developed, the CARICOM region, which is the Caribbean region on a whole, have moved towards the establishment of 5C, which is the Caribbean Community Climate Change Center. And through 5Cs, there are a number of informal training activities, whether they're certificates or just for information's sake, that young people or anyone have access to have this to improve their education and awareness with respect to climate change.
Perhaps one quick story. So, in this high school that Rosie talked about, Victoria, the regular, there's a special program about global studies. Andrew Weaver, most of you would recognize that name, is the leader of the Green Party in BC, has spoken to this group from time to time. And at the end of the sessions, a couple of times, the students asked him, so what can we do? And he said, the most important thing you can do is go home and talk to your parents. And they're doing that.
Hi, my name is Zainab, and I'm a student at the University of Toronto, but I'm here through Plan International Canada. And I had a question also related to the Nigeria case study, but it's open for anyone to answer. You spoke about needing institutional supports in order to combat climate change and improving health outcomes for people living in Nigeria. How would you ensure that resources are properly distributed in areas that are currently battling corruption? Thank you.
Yeah, thank you for that question. And that is why we're talking about community academic partnership. When you're talking about community-based research partnership, the community has ownership. And this is being influenced through a university. And when you're talking about a university, it has its own funding and its own mechanism for accountability in terms of structure. So it's not going through, understand what you mean, and that is why we zero down to a state, talking about Anambra State. The group, the National Coalition on Mental Health Research, is made up of 2 universities. So it's not just one person. And when you're talking about accountability structures, remember community-based participatory research, whereby everybody is accountable and the community takes ownership of everything. They are being just kind of knowledge exchange from the academic
Thanks for the question. I think it's a really important question, especially when we seek external donors. Institutional support is very key to climate change. Like I said in my presentation, we can't do it alone. So we need all partners on board, whether it's at the national level, at the regional level, or internationally. The issue of ensuring that resources are adequately channeled is that there is a need to have accountability structures in place. A lot of times around climate change, there is a whole issue of donor funding, especially to smaller and developing states and developing countries. And sometimes these countries don't have structures in place to ensure that there is accountability and that there is reporting. So I think that anytime there is the whole funding mechanism being looked at, there is a need to also look at support and to also build capacity in countries so that you're able to report and that you're able to also you also have indicators that countries can report on. But I would look at on the issue of sustainability because with funding, there comes a time when the time is expiring, and so the issue of sustainability must also be looked into this. But even when we're looking at the donors and we're looking at funding, how can countries sustain these activities after the time? And I think that is a very weak area that donors don't not look at so much. So they help, but then after the timeline of the project, the whole issue of sustainability should be looked at. And I wish to also touch on the point that was made in terms of community participation and community action. Everything goes back to the community and must start at the community level. Therefore, if you cannot have action at the community level and you cannot see results at the community level, we're going to fail. So it must be grounded, whether it is climate change or any other public health issues, it must be grounded at the village level, at the community level for us to see any changes.
Still emphasizing on the sustainability challenges because one of the challenges we had working with HIV was the community academic partnership was not functional. So you see that with donor funding from international bodies, by the time they are almost exiting, and is impacting on the stakeholders. When I'm talking about the stakeholders, the people that are affected. That is why the community academic partnership is very important because you're talking about knowledge exchange, capacity building of the communities affected, of the individuals affected. And when you're talking about environmental sustainability and environmental management, think about women that are users of the natural resources. And this is where women empowerment comes in. I don't know what I mentioned it. Anambra State has, according to National Demographic Health Survey 2013 for Nigeria, it talks about the state having the second highest literacy level for females in Nigeria. But ironically, is not translated into action and practices. So there is need for that individual and collective agency and action. And that is where CAP comes in for sustainability beyond funding. Thank you.
Thank you, and I'd like to thank you for bringing corruption out. It's the elephant in the room in all of this, and it is going to undermine all of our sustainable efforts. In the water sector, for example, Transparency International did a study and found that there's 30% of the funds in the water sector are lost to corruption. We talk about gender, climate change, water quality, quantity are affected by climate change and the sort of knock-on effects of climate change. If there aren't women in the water sector, then they're subject to the corruption because they're the ones who are basically don't have any way to afford water except through the corruption of the male counterparts in these water departments. And when we're looking at achieving SDG 6.1, 6.2, universal access to drinking water and sanitation, if 30% of the funds are not going directly to the infrastructure that they're being put towards, it's going to take us 30% longer to achieve that universal. So thank you very much, and it was brought up yesterday as well, and apologize for Chiz imperative on that one, but it's something that we can't ignore and that we shouldn't ignore. And I thought there was another question. Yes, thank you.
Thank you for your presentations. I would like to say to ask many questions, but I will try to be as brief as possible. Thank you first to Mrs. Ngozi for your very critical mind. I really appreciate this because I think that the public health and global health is not always the case. So you open many doors to think about. We'll come back to the academic where environmental working in Montreal, in Quebec, Mr. Rosmond, we just got funding to do some research about climate change, migration, and health in Dominica, Commonwealth of Dominica. So I will come back to you after to talk about that and to talk about the challenges that we will encounter because we just have to agree on the community um, participation. But I will not answer your question. I don't ask the answer to the question. But if I take the case of Dominica, that I think I know a little, is that there's a lot of at present community division because of political agenda. So that is probably one of the big challenge. I don't know if you, well, anyway, maybe you will have something to say about that community division that we could see since after Hurricane Maria, because it was clear that the government was giving stuff to some based on their political allegiance. I'm going back to Canada now. As I said, I'm prof at University of Montreal, and we are with some colleagues, only some, because it's a real challenge, try to convince the pension fund of the university, which is about, it's not a big one, but still it's something like $3.5 billion to divest from fossil energy and other social, socially not responsible investment. But we are really facing a war. Last time, recently at the General Assembly of the Régime de retraite de l'Université de Montréal, so it's the pension fund, I was even booing because we were talking with some of us about divesting, and they remind us that their agenda is to make money to ensure a fat, rich, and good retirement time. So that brings me to a very broad issue you were saying. Sorry, I forgot your name. The elephant in the room, certainly corruption, but I would say that probably capitalism is probably the biggest elephant, and maybe corruption comes from greediness and wanting to be rich, etc., profit. So I think that we all agree, no, we don't all agree. Some agree that if we look at climate change, but also in a broader sense, environmental degradation, but also poverty and social inequalities, we always come back to capitalism or neoliberalism. So I was wondering, so it seems that we are going straight to the wall. We can still limit some stuff at the level of mitigation, but it seems that we have to change our political, social, and economic capitalistic organization. So I would like to ask, what is your thought about it? And just some ideas coming back to, and also if you have some idea, Mr. Vic, about, I don't know if at your university you did anything about convincing those committees, retirement committees, to divest from fossil energy. Thank you.
Thank you. We only have 15 minutes left in the session.
Right, so I'll be brief. And I think that, I'm glad that you raised the question of politics. There's another elephant in the room. So we'll be filling the room with elephants and we have no space for us. But it's a real issue, and we have to look at politics and climate change because it exists. And I think that, in the context of developing countries, politics is very influential when it comes to climate change. So I do points to you, and I will speak afterwards in terms of approaches that you can take with respect to Dominica. But I think that what we have to try to do is try not to politicize climate change initiatives because they will impact us no matter what party we vote for or not. And second is that in order to really avoid politics, we should try to work through civil societies, academia, and grassroots organizations because traditionally you have very little political affiliation. So working through them, we can avoid having this the whole politics of
acting on the party, and those persons who are supported by opposition MPs are not getting those resources. And it brings us in the paradigm not only climate change, but for many sectors. So I think that really working and using civil societies and these grassroots organizations will help you to avoid a lot of these politics.
Yeah, thank you for that question. When you're talking about capitalism and neoliberalism, remember that you think about globalization, trade agreement. But one thing is obvious that climate crisis is here with us. Now, we also look at climate justice. When we're talking about climate justice, who are the main providers, if I should use that word, of greenhouse gases, and how is it impacting to global south. So we have to think about climate justice, and it's already affecting, it's already happening. I'm talking about, I told you about flooding issues, I told you about deforestation. But one thing you have to understand is that there are already structures of ground, because Nigeria was one of the countries that is affected by HIV/AIDS, and you have women-based civil society organizations that are still functioning even with the gradual exiting of international funds. Why? Because women are most impacted. We all know about the challenges of HIV towards women, both how it affects women and impacts on women. The same with the climate, with the climate crisis. Women, if you go to the internally displaced camps, majorly there are women there. They are the migrants moving from the rural areas, moving into the urban areas. They are affected. What is the most important thing? Poverty. They have to feed their children now, indirectly the men, their partners, their husbands. So one thing is obvious, it's not something we can avoid. There is no perfect situation, but however we look at it, it's already on ground. Thank you for that question. Whenever we talk about Nigeria, people say corruption, but one thing is obvious that even in that Nigeria, even in that country, there are still people that are not corrupted. I want us to take it home. That is one thing that is obvious. We take it home because of climate justice. Thank you.
Two quick comments to our colleague. One about the role of universities trying to do something about university investments and funds that we think should go elsewhere, and then one about capitalism. So about universities, there are a number of universities going through exactly the same experience that you described. University of Victoria is one. It's not an easy story, but some progress is being made. Here's a little pitch for a group within the coalition called the University Advisory Council. There are 29, 8, something like that, universities that are working together on things like this. The most recent university that signed up is, as a matter of fact, is the University of Montreal, with Professor Christina Zaraski. So please see her and see if we can work together on something like this. That's the pitch. About capitalism, there are a few documents that essentially say that what's needed is fundamental transformation, including the capitalist system. A recent book by Naomi Klein says the same thing. Let me just tell you about a group I've learned about recently in the UK called the Institute of Public Policy Research. Here's the website, www.ippr.org, and they have terrific documents. The one I have been waving around has the title, "This is a Crisis, Facing Up to the Age of Environmental Degradation," and has a great section on what's needed in our country for transformation. It's a similar document from Sweden, and so on. Back for a moment to young people. This same group has just produced a document about the role of youth. Has the title of something like Inherit the Earth. So please go to this website, click on the environment box, and some of these documents are available.
Thank you. there are some university sustainability networks as well. One actually has a few Canadian universities that have signed on to being carbon neutral by 2030, and I can't remember which ones they are, but good on you, because I think there are only 3 or 4. But there are some platforms internationally for universities to re-examine their sustainability. So that's another avenue for you. Yes, please.
My name is Ursula. I work with an NGO, it's one NGO in Nigeria, and I teach at the Untitled Chapter. When it comes to climate change, I think there's a sense of urgency. Whether it relates to health, housing, transportation, environment, lifestyles, communities, I think there's a sense of urgency. I have a comment and a question. My comment is the Canadian Institute of Planners, we have policy that deals with climate change mitigation and adaptation and action. And the emphasis is building healthy communities. The way we build our cities has to change because the cities are now ground zero for climate change. We know the population of people that are coming into the cities. So they are part of the planners for climate action, and they are impacting a lot of communities here in Canada as well as in the Americas. My question goes to the presentation from Nigeria. I know Anambra is one of the states, out of the 36 states. Right now, there are 24 states that are impacted by flooding. And I know that we have policies at the federal level, but the issue is those policies are not translating to the state or the local government level. So how does your work reflect the translation of these heavy policies at the national, to the local, and to the state levels? And also, as a side comment, Lake Chad is shrinking, and Lake Chad impacts, I think, 4 or 5 countries, Chad, Cameroon, and Niger. A lot of lifestyles, a lot of people have lost their lifestyles. They are moving, they are displaced, there is no water, there is no food. So are there any issues relating to that you are looking at in your work? Thank you.
Thank you.
Thank you, Shola, for that question. I want to say, yeah, 24 states that kind of have been affected. You know, this is just an initiative, the National Coalition on Eco-Social Health Research. It's just a new initiative that's been started in Anambra State. And when we're talking about pilot researches, pilot research, we're talking about pilot studies that can bring about impact factors and policy stages. This is something that can be done in a place and then be translated. When you now with advocacy, CSO's advocacy, we can get that to the level of the national. There are still back and forth discussion with the Federal Ministry of Environment, specifically the Department of Climate Change. Thank you.
Thank you. Anything resonate with the Caribbean or Canada? No? Okay. We have a couple of minutes left. I'd like to close, and in order to do that, I'm going to give the panelists about a minute each to summarize, but I'm going to tell them what they're going to summarize. And what I'd like them to summarize is the 2 key ingredients or factors that they believe are absolutely essential for this transdisciplinary, transsectoral governance advocacy imperative action that is climate change and health. So that's what I'm going to ask you. But before I do so, I'd just like to thank you, the audience, and as well as the panelists, and just a few take-home messages, if I may. Climate change and health is an imperative. Please, glad that you have mentioned it, raised it, and keep sharing it, particularly outside your friendship and work circles, because in this room, that's presumably the reason that we're here. It's the people outside this room, outside our sectors, that we really need to convince of this. And understanding and mitigating the impacts requires these multi-stakeholder models of engagement. And so we really do need to not only talk with, have good conversations and dialogues, create the spaces for dialogues, but we have to create these engagement mechanisms. And they need to be successful, which is why I've asked you to close with the key ingredients that we can all take home and work with. And hopefully you've taken some life lessons and some experiences and some wisdom home from these case studies to help you in whatever work you're doing around the climate change and health nexus. So with that, over to you. 2 key ingredients, critical elements.
Thank you. I want to round up everything to say that climate justice is very vital. Whatever we have to do for the climate crisis that is affecting everybody, everybody's feeling the pinch. Here you are in climate justice. And this also we have to bring in research, interdisciplinary researchers, because you see that climate crisis cuts across teams, it cuts across sectors. And I want to also emphasize the role of community researchers, because you see the community academic partnership has been functioning in the global north. Yes, we need to translate this also to global south. And secondly, I want to bring up the role of the media, especially in the global north. You see that even the baby in utero knows about climate issues in global north. We need to get that to the global south. The media is also not part of it. So that educational awareness to bring about health promotion so that everybody, it becomes a daily language. It becomes a word, a slogan that people actually understand what it means. That is my take home. Thank you, everybody.
Thank you.
So I think first of all, community participation with respect to climate change is very, very key. Paying careful attention to the youth and vulnerable population. These are the ones who we're going to depend on to take the fight forward into the future. So ensuring that our youth are empowered and we start action from the ground upwards. Too often we see like the question that was previously posed with respect to policies. There are policies that are written up there, there are some that are written up there, but the impact isn't felt on the ground on people who are affected, and therefore we need to start maybe looking at our approach and start from the bottom up. Don't depend on, yes, we require policies, and we know that there is a need for having direction and guidance at that level. However, there is a need for us who are on the underway impacted to really start having some changes there. And my second point is that we really need an oral society, our sector approach towards climate change, and we need to have all of the stakeholders coming together. We know at times there are conflicts, there are the who is for this and who is for that, but we need to see how can we bring all of the stakeholders together, because climate change and health is not our only health sector related issue. It is dependent on the climate change and the impact on other sectors. So if infrastructure, water, other sectors are impacted, it is going to impact on health and on the health sector. And so we need to really ensure that climate change and resilience is built into everything that we do. When we look at governance, when we look at culture, when we look at systems, when we look at financing, when we look at funding, climate change and resilience should always be part of these discussions.
My 2 points are urgency and young people. I don't think we really understand how urgent the situation is that we're in, both in terms of scale and speed. I hope you will dig out this article, this paper, because it enlarges on that. Through the various political debates we've had in the last few weeks, it really doesn't come through as an urgent problem. It is an urgent problem. And secondly, I really think that our younger colleagues have a role to play in providing leadership and energy about this. So I would ask each of you to go back to your situation, your universities, your NGOs, and see what kind of leadership you could stimulate